Hi, my name is Jonas. I live in San Diego and I'm an engineer. I've struggled with weight my entire life. As I entered into my 40s, it became much harder and I really just started to gain a lot of weight and it got a little out of control. I weighed 255 pounds. I was just not feeling good about myself in general. At work, we were going out to lunch like every day and eating out and not always making the best choices during those meals. And then Plenity came along and it was just like, this was a really good opportunity to basically make the changes in my life. So now with Plenity, I tend to eat less at meals. The main effect is really sustaining between meals. You can look at that half a sandwich and basically say, you know, I don't actually need that. And then you step on that scale and finally it's like, it's really started to move down. 10 pounds is gone and you're like, okay, this is actually, the changes I'm making are working for me. I've been using Plenity for 6 months and I've lost 30 pounds. One of the biggest effects for me was just self-esteem, like just feeling better about myself and the way that I looked and how clothes fit. It feels really good to be active with my son. Be able to like interact with him and not have weight in the way of that interaction. Thank you for sharing your personal journey. At Plenity, we believe in empowering everyone to live a full life. My son is a major motivation in me losing this weight and keeping this weight off.
Patients who are pregnant or are allergic to cellulose, citric acid, sodium stearyl fumarate, gelatin, or titanium dioxide should not take Plenity. To avoid impact on the absorption of medications, for all medications that should be taken with food, take them after starting a meal. For all medications that should be taken without food, on an empty stomach, continue taking on an empty stomach or as recommended by your physician. The overall incidence of side effects with Plenity was no different than placebo. The most common side effects were diarrhea, distended abdomen, infrequent bowel movements, and flatulence. Contact a doctor right away if problems occur. If you have a severe allergic reaction, severe stomach pain, or severe diarrhea, stop using Plenity until you can speak to your doctor. Plenity is a prescription-only therapy. For safe and proper use or more information, talk to a healthcare professional, read the patient instructions for use, go to myplenity.com or call 1-844-PLENITY.